One of the challenges with immunotherapy is that obviously, the only agent that we have FDA approved right now, immunotherapeutically speaking, is actually CYP/LT, right? Now, there's a lot of controversy about CYP/T, whether or not it really is an active agent or not, whether or not, who are the right patients for CYP/T in that context. I think that CYP/LT is a very effective treatment. It just unfortunately paid the price of being the first agent ever, in the context of immunotherapy approved for prostate cancer. Now, many of the challenges that one faces with CYP/LT, especially patients, is the lack of PSA response, the lack of RECIST-defined response, the lack of bone scan improvement, the lack of symptom improvement, and yet you appear to actually have a better outcome if you are exposed to CYP/LT than if you're not. So I think the question is, how do we incorporate CYP/T in the context of our management? And I think when you look at the existing data right now, perhaps using combination therapy of CYP/LT plus the oral agents, where that agent is enzalutamide or abiraterone acetate and prednisone, it is clear that maybe some of those challenges that we're seeing clinically about lack of PSA response, lack of efficacy, bone scan or RECIST-defined or clinical symptoms may in fact be mitigated by the addition of the oral agents without compromising the immune effect of CYP/LT, and again without maybe even maximizing survival. We still don't know that, but I think it's here to stay. I don't know who is the right phenotype. Clearly the IMPACT trial is different than what we tend to believe that the patients that we see right now in our practice. I would argue low volume disease, indolent disease, are the best candidates for CYP/LT. But I think in the context of the oral agents, that is the biggest question. You have 3, 4, 5 lines of treatment that you can utilize at the same time for your patient. So if you don't know who's the likely beneficiary of those agents, it puts a lot of pressure on how you select your treatments.